In July 2024, the Department of Children and Youth adopted new Step Up to Quality standards. These new standards were adopted with the goal of improving child outcomes, reducing administrative burden, and increasing parental access to quality settings. Under these new standards, Step Up to Quality has moved from a 5-star award system to a 3-level award system: bronze, silver, and gold. In this video, we will be going over the changes to the 1 and 2-star standards, which are now combined into the bronze award level. The biggest change from previous standards is that programs will now be required to be implementing a curriculum. Your curriculum must be aligned to the Ohio Early Learning Development Standards and the Science of Reading. Programs can find a list of approved curriculums at the link provided. Programs will also need to have documentation of current activity lesson plans that support children's development and learning and include experiences from your curriculum. Activity lesson plans for school-age children need to be aligned with the Ohio K-12 Learning Standards, which is also a change from the previous standards. Another big change from previous standards is that programs will need to complete a comprehensive developmental screening for all children and share the results with families. Developmental screenings need to be completed within 60 days of enrollment and re-screened annually. Results need to be shared with families within 30 days of completing the screening. School-age children, children on an IEP, and children on an IFSP are not required to have screening completed. Developmental screenings are completed through the Ages and Stages Questionnaire, or ASQ. Programs must complete an annual self-assessment in the form of an environmental rating scale for each age group of children. This would be the Infant and Toddler Environment Rating Scale, or ITERS, for the infant and toddler classrooms, the Early Childhood Environmental Rating Scale, or ECHRS, for preschool classrooms, the School Age Care Environmental Rating Scale, or SACRS, for the school-age classrooms, or the Family Child Care Environment Rating Scale, the FICRS, for family child care programs. Administrators will need to develop a continuous improvement plan with 2 program goals and action steps on how to reach those goals. These goals need to be updated annually. Child care administrators will need to meet licensing requirements. In addition, 50% of lead teachers need to have a CDA or CPL2, or one lead teacher needs to have a minimum of an associate's degree in an approved related field, a CPL Level 3, or a school-age lead teacher professional endorsement in a school-age only program. For FCC, the provider needs to have a CDA or a CPL1 or a school-age administrator professional development endorsement if only serving school-age children. If there is a lead teacher that is not the FCC provider, they will also need to have a CDA or a CPL1 or a school-age administrator professional development endorsement. PD hours will no longer be on a biennium basis. Under the new standards, all administrators, lead teachers, assistant teachers, and FCC providers must obtain 10 hours of Ohio-approved training annually. PD topics must include at least 2 of the following: trauma, developmental milestones, critical conversations, behavior classroom management, family engagement, curriculum and assessment, science of reading, inclusion. For the current year, July 1st, 2024 through July 30th, 2025, these topic areas will not be assessed, but administrators and teachers will need to complete their 10 hours of Ohio-approved trainings. After July 1st, 2025, these topic areas will be assessed. The program needs to utilize a tool that identifies the needs of the whole family. The tool needs to identify family needs in at least 3 areas, including developmental or educational needs, health needs, and resource needs, such as food and utility assistance. The tool also needs to document what resources were provided to the family. The tool needs to be completed within 30 days of enrollment and updated at least annually.